We're getting closer and closer to the brain as the quarter progresses. And in chapter 25 and 26, we're going to talk about the support systems for the central nervous system. So, chapter 25 is on the cerebrospinal fluid system, which is one of our support systems, and chapter 26 is on the circulatory system. And of course, in the course of discussing these, we will talk about pathologies of these particular systems. So, learning objectives for chapter 25 list the primary functions of cerebrospinal fluid and briefly describe the flow. I'm not going to expect you to know in detail, but just in general, what the flow is and the primary functions, like we've done with some of the other systems. We're going to talk about some pathologies, epidural and subdural hematomas, which are usually due to trauma, hydrocephalus, which is a fluid issue, and meningitis, which is an infective disease. So we will talk about the pathology, signs, and symptoms of all of those. So very interesting part of the brain support systems. So the cerebral spinal fluid system regulates the extracellular milieu, which is a word from the book that I love, and protects the central nervous system. So it has a protective feature. So it's formed primarily in the ventricles, and we'll look at the geography of the ventricles in a minute. It circulates through the ventricles and into the subarachnoid space before being absorbed into the venous circulation. So this cerebral spinal fluids, it supplies water, which, we need water, certain amino acids, specific ions that the brain needs and the neurons need, and it supplies these into the extracellular fluid and probably removes cellular metabolites from the brain. When we say probably, we don't know. So we know that the astrocytes and the microglia have an effect of taking up some metabolites as well. So it's all one big cooperative system. It's not necessarily that one part does one thing and another part does another thing, but the CFS system is definitely involved in removing metabolites from the brain. So the ventricles are basically spaces that are filled with cerebrospinal fluid inside the brain. There's a system of 4 ventricles, and it's a closed system. And you will notice when I said it goes through the ventricles and then it's absorbed into the venous return, it's not returned back to the ventricles. So, like our circulatory system is a closed system where the blood gets pumped around and returned. It does not get returned in the CSF system. So it's a one-way flow. It's not a closed circular system like the circulatory system. It's not a something where the fluid gets returned. We just have to keep producing more fluid. So the lateral ventricles are paired. There's one in each cerebral hemisphere. So it's a little reservoir in the middle of each cerebral hemisphere. It consists of a body, an atrium, and the anterior, posterior, and inferior horns. So when you think about it, it's like a little fluid space inside the brain that is providing some cushioning. Isn't that handy, right? Because our brain has to, take up some forces. The third ventricle is a narrow slit in the middle of the diencephalon, which is in the middle between the cerebral cortex. So the walls of the third ventricle are the thalamus and the hypothalamus. The fourth ventricle is a space posterior to the pons and medulla and anterior to the cerebrum. So all of those are the little fluid reservoirs. And then from the fourth ventricle, the fluid gets absorbed back into the venous system. So a closed system with one-way flow. The fluid itself is produced in the ventricles, and part of the structures that create the fluid is called the choroid plexus that creates the cerebrospinal fluid. You can do a spinal tap to withdraw cerebrospinal fluid and look for antibodies and pathogens and other things. It's a pretty serious procedure, even though it's outpatient, but still pretty serious. They have to have a really good reason for wanting to do that. The meninges are 3 layers of membranes that cover the brain and spinal cord. So the dura mater is the outer layer, and it surrounds the brain and is firmly bound to the inside surface of the skull. So the outer layer of the dura mater is firmly bound. The inner layer of it is butted up against the arachnoid. So the arachnoid is a more delicate membrane. So dura means tough. So dura is tough and arachnoid is more delicate, and it's loosely attached to the inner layer of the dura. And the pia mater is tightly opposed to the surfaces of the brain and spinal cord. So when you look at some of the anatomical pictures of the brain that are in the book, you'll see that pia mater. And for one thing that it does is it contains some of those veins and arteries that are supplying blood to the brain, very important, like a lot of the connective tissue in our body. But you can think of the meninges as being really super specialized connective tissue, if you want to think of it that way. So CSF, some of it is formed by extracellular fluid leaking into the ventricles, so just being taken up from the cerebral hemispheres. Most of the cerebrospinal fluid, like I said, is secreted by the choroid plexes in the ventricles. So they're in the ventricles and they're secreting that fluid. It's formed from blood by filtration, active transport, and facilitated transport of certain substances. So the CSF has to have particular amino acids and ions in it to support the nervous system, and those things have facilitated transport channels to get into the CSF. So pretty important. We got to feed our brain, right? Common disorders of the cerebrospinal fluid system, subdural and epidural hematomas, which are usually caused by trauma. So if you get hit in the head, like you ski into a tree, or you are in a car accident, or somebody punches you in the head, you know, you can imagine any ways that you might have had trauma. It can cause these hematomas, which is a buildup of blood. And we'll talk about subdural versus epidural. And the dura refers to the dura mater. Hydrocephalus, which, like it sounds, it's water on the brain, so excess fluid. Meningitis, it's inflammation, and it's usually caused by bacterial or viral infection. So either one, there are some bacteria that cause meningitis and some viruses. So with epidural and subdural hematomas, like I said, they're usually a consequence of trauma. Epidural hematoma is arterial bleeding, and a subdural hematoma is venous bleeding. So when you think just what you know now about arterial versus venous bleeding, they're different, right? Arterial bleeding tends to be faster and more profuse, and venous bleeding tends to be slower. So when we think about the onset of signs and symptoms for epidural versus subdural, that is helpful to think about. So epidural hematoma, it's arterial bleeding between the skull and the dura mater. Okay, there's not a lot of space in there. It most often results from a torn middle meningeal artery caused by a fracture of the temporal or parietal bone. So the temporal bone is sort of over your ears, parietal is a little farther back and higher up. So you can imagine what could happen, you know, car accident, mugging, skier versus tree, that might cause something like this. So the signs and symptoms are a headache that keeps getting worse, vomiting, decreasing consciousness, hemiparesis, and Babinski's sign. That's where you stroke the bottom of the foot and the toes spread out. So those aren't good signs. And epidural hematoma usually comes on really fast because you think arterial bleeding, it's bleeding fast. Um, the subdural hematoma, the signs and symptoms are similar, but they tend to gradually worsen over days or months. So say you were in some situation where you hit your head. So you were running up the stairs and you slipped and fell and hit your head. And nothing seemed to have come of it. And you're like, I'm okay. And then over days, you start to have a worsening headache, maybe decreasing consciousness. You start to have motor symptoms, the hemiparesis. Okay, that's a sign of a subdural hematoma. So with epidural hematomas, the symptoms come on faster. With subdural hematomas, it can take a long time for them to come on. But anytime when you have worsening headaches and decreasing consciousness, that's a that's something to pay attention to. There's something wrong. So with hydrocephalus occurs if the cerebrospinal fluid circulation is blocked and pressure builds up in the ventricles. So like I said, with the subdural and epidural hematoma, there's not a lot of space in that um, between the skull and the dura mater. And so if you get fluid building up in there, it's going to put pressure on your brain. And that's what causes the headache and the decreasing consciousness. So the same thing with hydrocephalus, um, the pressure builds up and it causes pressure on the brain. So there are different types of hydrocephalus. Common causes include the failure of the fourth ventricle foramina to open, so the fluid can't get out of the fourth ventricle into the rest of the CSF system. A blockage of the cerebral aqueduct, which is that little narrow passage. Dandy Walker cysts, which is a particular kind of CNS cyst, and an Arnold-Chiari malformation where the brainstem is coming out from the foramen magnum, and so you get pressure on the cranial nerves, and obviously pressure on the ventricles. So if an infant or a young child is born with congenital hydrocephalus because their fourth ventricle foramen didn't open, the signs that you'll see are a disproportionately large head size because of that extra fluid, a large anterior fontanelle, that's the soft spot in the baby's skull that hasn't ossified yet, poor feeding, inactivity, and a downward gaze of the eyes. With any type of hydrocephalus, it's usually categorized as communicating or non-communicating. In communicating hydrocephalus, the ventricular system is intact. So there's some other reason, like there's an obstruction or some other reason that's causing the fluid to build up. In non-communicating hydrocephalus, the blockage is within the ventricular system itself, most often the cerebral aqueduct. So you can have in adults, with children, it usually shows up early. In adults, when you have hydrocephalus for whatever reason, you can have hydrocephalus that is not building up pressure, that's just slowing the flow of CSF, and it's called normal pressure hydrocephalus, and that tends to have cognitive and motor effects. So the pressure builds up a little bit, you start to get decreased consciousness, confusion, and motor effects, difficulty coordinating movements. I worked with one person that had normal pressure hydrocephalus, and really until you put some stress on the systems, you wouldn't think anything more than this is just like a normal elderly person with maybe a few balance issues. Well, once the person started to fatigue, you started to see the cognitive issues and the and more motor effects. So it was interesting and challenging. So usually for congenital hydrocephalus is the most common cause, and that's the one that you see in children. And it's the failure of the fourth ventricle foramina to open, or blockage of the cerebral aqueduct, or cysts in the fourth ventricle, or the Arnold-Chiari malformation. In older children or adults, The cranium can't expand. So with newborns, they have those soft fontanelles that the bone hasn't ossified yet, and the cranium can expand. So you see that larger head with where people, once their bones have ossified in their skull, they get excessive pressure in the ventricles, and that compresses nervous tissue, particularly the white matter. So white matter is all about communicating from neurons to neurons in different areas of the cerebrum. And so that's where you get the cognitive effects from hydrocephalus. So this diagram is of a shunt. So that's normally how hydrocephalus is treated. They shunt the fluid that can't get out of the fourth ventricle um, out of the area and down into the venous system. Basically, they return the fluid to the venous system, which is normally done through the ventricles, but in the case of hydrocephalus, it's not. So that shunt helps keep the pressure normal. Meningitis is where the membranes of the cerebrospinal system are infected with a virus or a bacteria that and so you get inflammation of the membranes that surround the brain and spinal cord. So signs and symptoms of meningitis are headache, fever, confusion, vomiting, neck stiffness, sometimes photophobia, so the sensitivity to light, and it can be a bacterial or a viral infection. If it goes untreated, you can have serious symptoms, like you can have hearing loss and vision loss and permanent hearing loss too, permanent vision loss. So it's definitely, there are vaccines for the viruses that cause meningitis now, which is good. And there are it can be treated, bacterial infections can be treated with antibiotics, but it's pretty serious. You can have serious repercussions if meningitis goes untreated, including potentially death.